Hello, it's me again. Today is September 10th, and I am just recording a quick update video about the next step, which is radiation. So this week was a big week. I had quite a few appointments, and the biggest one was yesterday, which was my appointment with my radiation oncologist. So I'll kind of go through the week. Tuesday I had my injection, which I get every 3 weeks, so I'm still getting that treatment, and that will go again until end of February, early March. And then Wednesday, so a couple weeks ago I had an echo. I don't remember if I mentioned that, but they're just kind of getting just a checkup on my heart. I had an echo at the beginning of chemo, and I got another echo, which is just like an ultrasound of your heart, to kind of make sure that things are doing good, because some of these chemotherapy drugs are really known to be really hard on your heart. They were not able to see everything. They weren't worried, but they weren't ever able to see everything that they wanted to see, probably because I just had surgery, in front of my heart and my chest, and there was a lot of inflammation and swelling internally still. So they couldn't see some certain things. And so Wednesday I went in for MUGA. I don't really know what the test is called, but basically what they do is they start an IV and they take out some blood, and then they inject it with some like radioactive material, radioactive tracers. And then you have to kind of wait a while for it to activate, and then they inject the blood back in through an IV. And as they're doing that, you're in this big machine. All machines to me kind of look alike. You're in this big machine, and they take pictures in the machine. That takes about 30 minutes of like the blood going in and the blood going in your heart and all this stuff. And so you just lay there, and but those results came back. Everything's looking very normal. They're really happy with like how my heart's reacting. Okay, so then Thursday I had an appointment with my new radiation oncologist, and she's amazing. It's like super qualified. Like, I looked her up, and she just has like everything you could ask for. Top of her class in Harvard, just a great, and lots of boards, lots of published articles, and she's great. So met with her and her nurse practitioner, and kind of got the plan of treatment for radiation. So from what I had understood talking to my oncologist a couple weeks ago, that there was not a consensus on whether I technically needed radiation. So I kind of went into this appointment thinking all right, so if they suggest it, we're going for it. If they don't suggest it, I'm not going for it. If they think the risk outweigh the benefits or anything like that, I really want to consider all my options. But from her standpoint, I mean, they're treating this really aggressively. There's no question in her mind that I need radiation. And the type of radiation I need is 6 weeks of radiation. And I thought it was going to be anywhere from 3 to 8 weeks. So that's kind of in the middle, on the longer side. 6 weeks of radiation. And I'll go 5 days a week, Monday through Friday. And I'm going to get radiation basically in my chest area and my lymph nodes. So it's going to be from the top of my collarbone all the way to center line of my chest to under here, and then also this whole armpit area. And so this huge area is going to be getting radiation. And she said, so far all my scans have come back clear, and there's no evidence of cancer in my lymph nodes. But she said that this radiation will prevent or kill any cancer cells that may be hiding in tricky areas. And she says that her fear is that if we didn't do radiation, is that the cancer would come back, because it already has been known to come back, and come back really quickly, and come back changed, more invasive, with it the second time it came back. There was only 7 months when my cancer came back, and the way it came back is, it came back HER2 positive. So her thought was that we just didn't want to kill any kind of cancer cells that may be left, and after my surgery, you know, my margins were clear, but there were still some DCIS in my breast. And so they just like don't want that to, you know, come back. And so that's the plan. This coming probably Thursday, it hasn't been scheduled, they're supposed to call today. I'm gonna have a simulation where I'll go in and I'll like get a tour of the facility and everything. I'll get some like markers on me and I'll get a CT scan and I'll lay on the table, I believe, and like as if I was gonna get radiation and like line me up and everything like that. Could take a couple hours. And then maybe like that following Monday, so like 2 weeks or about a week and a half now, I'll hopefully start radiation then. And yeah, so if that's the case, then I'll be done at the very end of October. And it kind of did just feel good to have like almost end date. And I know I'm not done because then I still like every 3 weeks have my other therapy, which is a shot. And then, you know, but it's still like it should feel good just to kind of have another plan set in place and like not have any more question of whether I needed it or didn't need it. And yeah, so that's the plan right now. It's gonna be hard, just like the daily process of like going in every day and being away from the girls, and we have to like make a plan, and we'll be able to make a plan a little bit better once I have a time, because it'll be most likely the same time every single day. And I shouldn't have to miss any days because there's no holidays or anything like that scheduled. But it will be like yellow jacket just landed on my finger. Okay, it will be a tricky process. And I have some thoughts like about that, and like some plans I'm hoping to do. We'll just kind of see how it goes. Side effects from radiation. So there are some like very small side effects long term. Heart problems is a big one, but it's like less than 1% chance. And she's gonna, when they do the CT scan, like, you know, because the side I'm having radiation is my heart side. And she's gonna like make sure there's not too much heart in the radiation area, and if there is, they're gonna like adjust things. And so like they're gonna take like my heart into big consideration. And then also to protect my heart, I'm gonna be doing some like breathing techniques, they said, where like I'll hold my breath, and because it like expands your lung, and then that just creates even more space in between my the radiation, the external radiation, and then my heart. There is like a less than a 1% chance of developing another type of cancer from radiation, and that is like a type of skin cancer, I believe. And lymphoma is also another small possibility. I already have a chance of lymphoma because I've had some lymph nodes removed in my armpit. And this just does increase it, but from what I understand, again, it's a small percent chance, and it's not like as if I've had all of my lymph nodes removed. Then you like have a huge chance. And I still have majority of my lymph nodes. I just have my auxiliary lymph nodes removed. And then the big side effects that I am gonna experience is skin problems, kind of like a severe sunburn, and it's accumulative. So like towards the end of radiation, it's gonna get worse and worse. I could blister and peel. Not everyone does, but I could. The skin could become like rubbery and, you know, like a bad tan or a bad burn or something. And so again, that area is gonna be like all the way up to above my collarbone, and so it could be visible in some clothing. And there'll be some things to help medicate that. And then tiredness is gonna be the other factor. And so I'm gonna be doing some things like I'm gonna be intaking. I'm gonna be prioritizing eating right and eating like protein, and then also exercise. And so I'm hoping to be able to start jogging like while I'm like right after radiation. So like on radiation and like workout clothes, doing radiation, and then like stopping and doing a quick jog on my way home before I go home. And so that's why I'm like kind of depends on the time of day and how things work out, but that's kind of my goal. I feel like that'll be a good time, because right now I could jog with Charlotte, but then I have Abby, and Abby's still kind of little, and I don't want to jostle her too much. Like they say not to really jog until they're 9 months, and so I've been waiting on that. Then it's gonna be like winter basically. So anyways, that's kind of the plan. again, it does feel good just to have a plan, something in place. And I'll update as I am doing radiation. Once a week, I'll meet with my oncologist. And yeah, I'll be doing probably videos about side effects and how I'm feeling every week or a couple weeks or something. But that's the big update.